All right. Good morning, everybody. Dr. Arapich here from Vet Triage. It is October 31st, Thursday, 2024. Happy Halloween, 8:36 a.m. Pacific time. We are going through this issue of JAVMA. This is the May 15, 2018 issue. We are talking about the ECG of the month. These are always tough because they are based on pictures, these ECG strips that are here. And I don't have a good way yet of pointing this stuff, but also cardiac disease is difficult, not my strong suit. So a lot of this stuff is going to assume that you know some basic to moderate level of cardiology, and I'll try to explain things as we go. So this is a case of a 9-year-old domestic short hair that was going to undergo anesthesia for a right carpal arthrodesis. So the right carpus, the wrist, arthrodesis is fusion of the joint, and it's because the cat had a hyperextension injury. So something happened where the cat landed on its foot and extended it too far, destroyed the ligaments, and now needs surgery. So the cat was on buprenorphine for analgesia, robinoxicib, which is a non-steroidal anti-inflammatory. The cat also had a history of idiopathic epilepsy, so she's been well controlled with Keppra. She did have 5 years ago diagnosed with mild hypertrophic cardiomyopathy as well, HCM, and the cat was overconditioned, meaning he was fat. So they did an echocardiogram before anesthesia. They saw there was an increase in left ventricular wall thickness. So the left ventricular, the free wall, so the outer edge of the heart, not the inner chamber part, was thick, but normal chamber sizes, which means this is hypertrophic cardiomyopathy. So they did a ECG strip before anesthesia. They saw a sinus rhythm. Sinus means normal. It's coming from that AV sinus node, and then which is arterioventricular node. And they also found the ECG strip low voltage R waves, which was considered to be a result of the patient's obesity or axis deviation. Axis deviation means when the clips of the ECG are not perfectly placed in the patient, or the patient is moving or something, then the readouts are going to be a bit off. So the cat was pre-medicated with midazolam, which is like Valium, methadone, which is another analgesic, aflaxolone, which is a short duration sedative, and placed on lactated Ringer solution, which is fluids, IV fluids. Okay, ECG interpretation. So the first ECG they're going to talk about is this one right here. And what they're saying here is that the QRS complex morphology was triphasic with a notched R wave of low voltage. They also said that there's sinus bradycardia, meaning the heart rate is normal, the heart rate is low, but the rhythm is normal. And they saw a borderline ST segment elevation. So that's what that is. So there you go. If anybody wants to look at that and try and figure that out, it'll be more evident with the next ECG, which is this one here. You can see how things have changed. See how now you have like these spiked areas here. So that's the main focus that I have on here. So the cat the cat received a blockade of the radial and median nerves of the right forelimb, performed with nerve stimulator and bupivacaine. So they did local anesthesia to help numb the leg for surgery. And the cat was hypotensive, bradycardic, and hypothermic. They gave glycopyrrolate, which is like the same class as atropine, to help that bradycardia, so help the heart rate go from low to more normal, and it did increase briefly. Then they did the second ECG strip, which again is this one here. And what they said was there are now two QRS complex morphologies. So you have the previous ones, which are like this guy here, and the ones all the way over here. Then you have the second one, which is these ones with the longer spike at the bottom. So the first appear identical to the QRS of the initial ECG strip. The second was biphasic with a deep S wave, that's that spike, and a high normal QT interval, alternating runs and occasionally in a bigeminal pattern. There was persistent borderline ST segment elevation. The cat's blood pressure did increase, temperature increased. The cat recovered from anesthesia. Discussion. So they're calling this rhythm an isorhythmic atrioventricular dissociation. This occurs as a result of slowing of the normal pacemaker rate or acceleration of a junctional or ventricular focus. So if something is slowing down the conduction from the heart from top to bottom, because that's how the heart conduction goes, then you end up getting this isorhythmic atrioventricular dissociation. Given the sinus bradycardia in this cat, a high ventricular escape focus was considered most likely. So that what that means is the ventricular escape. It means that something is blocking the conduction of the heart from the AV node, so atrioventricular node at the top of the heart, down to go into the AV junction and then the ventricles. So when it does that, the heart will compensate by having the ventricles release a beat instead, because the heart can't stop. So that's the high ventricular escape focus. This was described as isorhythmic because of the similar heart rates of the sinus complexes and escape complexes. So even though there were two different complexes here, the heart rate stayed the same. So they're calling that isorhythmic. The escape beats mimic true sinus complexes owing to the apparent maintenance of the PR intervals. Isorhythmic atrioventricular dissociation is designated as there's 4 types. So type 2 was this one because the relationship between P waves and QRS is static during the recording. Type 1 is characterized by oscillations of the P waves through the QRX complexes and back, which are associated with variation in baroreceptor response because of variable contributions of the atrial systole to ventricular filling. Let me interpret all that. Type 1 is characterized by oscillations, meaning back and forth, of the P waves. That's the first indentation of a ECG, of electrocardiogram, through the QRS complexes and back, which are associated with variation in baroreceptors. Baroreceptor response. Baroreceptors are receptors in the body that help control the rhythm of the circadian rhythm, the blood pressure. They're very powerful receptors in the body. And and then there was, and because of variable contribution of the atrial systole to ventricular filling, meaning again, if the atria are not contracting systole because of some sort of blockage, which is the whole point of this, then the ventricles won't be able to fill as appropriately with blood as they're supposed to. Alternatively, the rhythm may represent phase 3 or phase 4, which is a form of rate-dependent conduction abnormality. So these are 3 and 4. So if an impulse arrives at the ventricle sooner than the preceding one, it may arrive during phase 3 of the action potential. If this occurs, the memory potential is more positive, making fewer fast sodium channels available. The complex occurs during the relative refractory period and therefore may be conducted aberrantly. Phase 4, aberrancy occurs with the slowing of the R interval such that latent pacemakers in the His-Purkinje system start to spontaneously depolarize toward threshold. This results in some fibers becoming unavailable to propagate the subsequent action potential. Thus, aberrancy occurs with longer R intervals. Phase 3 and phase 4 are both considered less likely to occur than isorhythmic atrioventricular dissociation in this cat because there was no measurable difference in R intervals at the time of transition in the QRX morphologies. We're going to leave that there because that's a lot, and I'm going to mess up the interpretation of that. So then, atrioventricular dissociation has been reported with the use of volatile inhalant anesthetics. So that's the gas anesthesia they use for this cat's surgery. It depresses the sinoatrial, that's SA, and AV nodal automaticity, whereas the distal conduction system may be spared. So again, blocking the SA node, blocking the AV node, and then the conduction has to go to the ventricles. So inhaled anesthesia will block the electrical current going from the SA node to the AV node to the ventricles. So this allows an accelerated pacemaker to predominate. However, AV dissociation is not common in patients with anesthesia. Therefore, they thought maybe hypothermia was the cause of this. Hypothermia decreases spontaneous depolarization of pacemaker cells. Spontaneous meaning it happens spontaneously, and depolarization is the conduction, the start of the conduction of the heart contraction. Pacemaker cells are cells that manage the pace of the heart. And it slows impulse conduction. Hypothermia-induced isorhythmic Atrioventricular dissociation is typically not responsive to atropine, which may explain why this cat didn't respond very well to glycopyrrolate. Atrioventricular dissociation in an awake hypothermic bradycardic cat has been reported. Hypothermia may also increase the risk for supraventricular arrhythmias and potentially ventricular arrhythmias. So supraventricular arrhythmias mean arrhythmias that are coming from a place above the ventricles in the heart, and ventricular arrhythmias are arrhythmias coming from the ventricles. The high normal QT interval is suspected to be a consequence of the cat's profound hypothermia, but also may be attributable to bradycardia. Hypothermia prolongs the action potential duration and results in abnormal repolarization. Repolarization is the restarting of the electrical current so the heart can beat again. If ST segment elevation was truly present, it could be indicative of myocardial ischemia attributable to either anesthesia-induced hypotension or perhaps the cat's cardiomyopathy. Induced hypotension is desirable during surgery with a high expected blood loss to mitigate risks of severe hemorrhage and allow better surgical view. And myocardial infarction is rare in surgical patients with induced hypotension. And then finally, Osborn waves, defined as positive deflections in the terminal portion of the QRS complex and elevation of the J point, are classically associated with hypothermia, but have a more rounded appearance than the flat ST segments seen in this case. That's it. That's the case. That's a lot of information. Thanks for those who are watching. Hopefully you could pick up some gems here. I know I did. But yeah, cardiology is quite complex, and without showing you actual pictures, it's difficult to convey the message, but that's okay. We get what we can out of it. We'll see you guys again tomorrow. Thanks so much. Have a safe and happy Halloween.